and welcome. I'm Rebecca Broyles, co-owner and educator for the Medical Coding Education. Hello and welcome. I'm Rebecca Broyles, co-owner and educator for the Coding Corner Medical Coding Education. Today I want to talk about Pediatric Coding Unlocked, mastering accuracy, complexity, and clinical nuance in children's health. Pediatric coding is not simply adult coding in smaller bodies. Children have unique conditions, developmental considerations, and preventative care requirements. Coders should already understand CPT and ICD-10 basics. Today, we'll focus on the nuances, accuracy, and clinical interpretations. Some key points to remember throughout. Understand pediatric specific coding rules and documentation requirements. Apply CPT and ICD-10 CM guidelines unique to children. Navigate preventative, acute, and chronic pediatric encounters. Correctly code pediatric procedures and evaluation and management services. Work through real-world pediatric case examples, and strengthen compliance and reduce audit risk. Pediatric coding requires understanding the developmental stages. For example, asthma, otitis media, and behavioral conditions are coded differently in children. Preventative visits are more detailed and include age-specific screenings. The age-specific guidelines from newborn, infant, child to adolescent, growth and development influence diagnosis selection. Preventative care is more frequent and more detailed. Vaccine coding is complex and high volume. And pediatric conditions often have different ICD-10 codes than adult equivalents. Pediatric E&M coding essentials. Newborn care codes. Preventative visits are the new and established, and sick visits. The preventative visits include developmental screening, anticipatory guidance, and age-appropriate risk assessments. Sick and preventative on the same day require a modifier 25. Preventative visits are not time-based, they are age-based and content-based. And sick visits require separate documentation and medical necessity to support modifier 25. Preventative visits must include age-appropriate components. Missing growth parameters or anticipatory guidance can lead to downcoding. The pediatric preventative visit documentation should include a comprehensive history, growth parameters such as height, weight, head circumference, developmental milestones, vision and hearing screenings, immunization status, and anticipatory guidance such as nutrition, safety, behavior. Pediatric preventative visit examples. 2-year well visit. The CPT code would be 99392, and you would code the applicable ICD-10 CM codes for the diagnoses. If the documentation supported, you could code the CPT add-on code 96110 for the developmental screening and 99173 for the vision screening. A 2-year-old well visit with acute otitis media. The CPT code would be 99394 for the preventative and 99213 with a modifier 25 for the sick visit covering the acute otitis media, if documentation supported. Pediatric sick visit coding. Use the standard E&M codes from the range 99202 through 99215. Medical decision-making is often moderate due to age, risk of complications, and parental concerns. Some common pediatric diagnoses are otitis media, asthma, viral infections, strep pharyngitis, and gastroenteritis. The pediatric medical decision-making often trends higher because children cannot reliably describe symptoms, increasing diagnostic uncertainty. Some pediatric sick visit examples: acute otitis media. The CPT code would be the 99213, and you would use the appropriate ICD-10-CM code. Then moderate persistent asthma exacerbation could be CPT code 99214 if the documentation supported the level of medical decision-making. Viral gastroenteritis, CPT 99213 with the applicable ICD-10 code. Pediatric procedures often require additional time and restraint, but this alone does not justify modifier 22 unless complexity is documented. Some pediatric procedure coding. Common procedures are ear lavage or cleaning out the ear, foreign body removal, laceration repair, nebulizer treatments, and simple fracture care. Many procedures require documentation of technique, location, complexity, and materials used. Some procedure examples: ear lavage. The CPT code 69209 is for non-instrumentation, and CPT 69210 with instrumentation. Nebulizer treatment, CPT 94640. Simple laceration repair, 2 centimeters on the forehead, CPT 12011. The documentation requirements for laceration repair is the wound length, the location, the technique, and the materials. Vaccine coding is one of the most common pediatric audit areas. Counseling must be documented to support the 90460 and the 90461. Here you see the vaccines require 2 codes, one for the administration code and one for the vaccine product itself. The 90460 and 90461 apply when the provider provides counseling and the patient is under 18 years of age. Remember, in vaccine coding, that multiple components equal multiple units. Some vaccine coding examples: MMR plus the counseling, CPT code 90460 for the first component, and CPT code 90461 times 2 units for the additional 2 components, and CPT code 90707 for the MMR vaccine itself. For the flu shot with no counseling, CPT code 90471 and 90686. Counseling must be face-to-face and documented. Some pediatric ICD-10-CM nuances. Many pediatric conditions have age-specific codes. Some examples are the failure to thrive, developmental delay, newborn jaundice, and pediatric obesity. Also, social determinants. The Z55 through Z65 codes are common and important. Use the Z codes when appropriate. Pediatric care often involves social and environmental factors. Some pediatric documentation pitfalls. Missing growth parameters. No documentation of developmental milestones. Vaccine counseling not documented. Sick plus preventative visit documentation not clearly separated. And missing laterality for ear infections. Missing documentation leads to downcoding or denials. Encourage proactive queries. Here we see a 4-year-old well visit that comes in with a cough and fever. The provider performs preventative exam, gives DTaP and IPV vaccines with counseling, and evaluates an acute URI or upper respiratory infection. The CPT codes would be the 99392 for the preventative, a 99213 with a modifier 25 for a sick visit, the 90460 times 2 for the DTaP components, 90460 plus 90461 for the IPV components of administration, 90700 for the DTaP immunization itself, and the 90713 for the IPV immunization itself. Some key takeaways. Pediatric coding requires understanding age-specific guidelines. Preventative visits are detailed and documentation heavy. Vaccine coding is complex and high volume. Sick visits often involve moderate medical decision-making due to age and risk. And documentation must support all services billed. Pediatric coding blends clinical understanding, developmental awareness, and technical accuracy. Thank you for watching today. Please visit us at www.thecodingcornermce.com.